Assalamu alaikum and welcome to Ramadan for Better Health. We hope that you're having a good Ramadan. Happy Ramadan to you. And we do appreciate Allah subhanahu wa ta'ala and are very grateful to Him for allowing us to live, to have life, to fast this very important month for us as Muslims. Today's health topic, we're going to be talking about human growth and development. We're joined by a pediatrician. He's a clinical pediatrician and also a neonatologist. Dr. Hisham Tawakkul. Assalamu alaikum to you, Doctor.
Alaikum assalam wa rahmatullah. Thank you very much.
All right, so today's topic, we're talking about human growth and development. I guess this means that there's certain things that we're supposed to be able to do and certain growth milestones we're supposed to reach according to a certain schedule. Is that the general idea of it?
Sure. So it's two components, growth and development. And growth, it can go by some elements, of certain measurements that actually we do, like birth weight, like the height of the baby, if you're talking like about baby after delivery, and what we call also the head circumference. So actually, each pediatrician should we have growth chart, we call it, and there's many growth charts coming from different authorities. The WHO is providing growth charts, and the CDC, the Center of Disease Control in the States also are providing some growth charts. So, but every pediatrician should have what we call the growth chart, especially in the first 3 years of life. And with each visit to the pediatrician should measure these things: the birth, the weight, the height, and the head circumference, because this gives you an idea about the growth of that infant until 3 years of life.
Head circumference. This is the measurement of around the size of the skull?
Exactly.
Why is that so important?
Because this is give you an idea about the brain growth. So this is a rough estimate that the brain is growing as scheduled.
Okay.
If any child have a rest growth of the head circumference, mean is not actually growing as scheduled, and I said, the pediatrician will measure the head and plot the measurement in the graph he has. The graph he has for the growth for the head circumference. If that head circumference, the value is not increasing, that means that the brain is not growing as it's supposed to. There's a certain problem that the pediatrician should look after and look and investigate what is the problem here. In contrary, if the head growth or the head circumference is actually going more than what he see on the graph, that's another problem. That might be actually obstruction and at certain points of the fluid that runs in the brain, and that's a problem called hydrocephalus, meaning that the brain now is full of fluid. And the only way to detect this is by measuring the head circumference and plotting on the graph, so the pediatrician will know that the head is growing faster than usual. This will be the first indication that the pediatrician will investigate this more, and he might refer this infant or child for a scan or ultrasound or whatever to investigate the reason for this fast growth of the circumference.
Doctor, can you talk about the hormones? Is it hormones that regulate the rate of growth?
There are actually many factors. If you're talking only about the growth, there are many factors that control this.
Okay.
Among them, like you said right now, is the hormones. But the one what's also important to dictate the rate of growth is the nutrition that you're providing for that baby. When we broke down the elements now of growth, we talk about weight, head circumference, and height. So nutrition will be an estimation. When you measure the weight of the baby, that will give you also a rough idea about the nutrition that you are providing for this baby. As I said, every visit, the pediatrician will weigh the baby and plot him on the graph he has. And usually we don't change the graph. So every patient will have a growth chart for this pediatrician. So he will, every visit, he will put a point, and then the pediatrician can follow the pattern of growth for that child. That's why it's not actually recommended that you change the pediatrician a lot, because this will be lost. Usually you stick with the one pediatrician, so the pediatrician can follow up the pattern of growth. So the weight will be an estimate for the degree or the how good is the nutrition provided for this child. If also it happened at certain point that the baby or the infant is not gaining weight, that means that there is a certain problem around that time that predispose the baby for failure of growth. And that baby has to be investigated. The pediatrician should look for this problem, find what is the problem, what's the cause for it.
Yes.
And sometimes actually he can admit the baby in the hospital if he cannot find the cause for this problem in his clinic.
I'm wondering about the role that genetics plays. If I understand genetics correctly, it determines the eventual height that we may or may not reach. Is that the only role of genetics, to determine the end of our height and growth?
Okay, so as I said, this is growth and development. We mentioned the first part, which is growth. And we broke it to the elements of growth that maybe the pediatrician will follow to have an idea about how this baby from birth actually is growing. The other part, we said, is growth and development. So the other part will be the development.
Okay.
So, and you ask about genetics. Let's define first what development means. So development means like how the baby is developing and growing. What are the tasks that the baby achieve while the baby is advancing in age?
I see. So development means like the activities.
Exactly. Exactly. What's the activities that the baby can do using certain skills at certain period of his age, of his life. What you expect from a baby who's 1 month old is, of course, is completely different from what you expect from him at 1 year of age.
I see.
For example, the baby at 1 month of age, all what you expect from him is that the baby maybe look in your face, maybe move his eyes little bit with you, and that's it. But when the baby is 1 year age, now you expect the baby from him to walk without support. He will be able to say few words, and he will be able to use his hands to do certain elements that the baby at 1 month is not capable of doing. Between the 1 year and between the 1 month and 1 year, as long as the baby is advancing in age, you will expect more and more from the baby, for example. And we break this development again to 3 elements, what we call gross motor, fine motor, and language. The gross motor is what the baby is doing, the kicking, the running, the turning over when the baby is sleeping. This is we call gross motor. The thing that the baby can do is his body. Then our fine motor, which the baby can do with his hands. At 4 age, for example, can put his hands together. The baby at 6 months maybe can hold a cup. Then baby can drink by himself.
Yes.
Or can bring the bottle to his mouth. Or can hold a box. Or then hold a piece of Cheerios or a small piece of paper by only 2 fingers.
Yes.
Or the baby can draw a circle. That's the fine motor development for that child. The last thing is the language. We mentioned 1 month and 1 year. Of course, the baby at 1 month is not capable of talking or saying anything. And maybe after a few months, the baby will just start by what we call cooing. The baby will say only ooh, ooh, ooh. But then as far as the baby is growing, then at maybe like 8 or 9 months, the baby can say da, and then later will say ma, ma, ma. Then the amount of language will increase by time. And when the baby reaches 2 years, then you can expect him saying few words and sometimes even combined 2 words together. So this is what we call development. Gross motor, fine motor, and language. And it will increase. The baby will build his experience as long as the baby is growing in age.
And so it sounds like there's a chart that you can plot the growth and development, looking at his or her physical growth, and also charting his or her movement along, in terms of performance, the 3 areas: gross, fine motor, and language skills.
Sure. We mentioned the graphs that the pediatrician should have in his clinic to plot the baby in every visit, look for the elements of growth. But also there are graphs that can tell you to estimate what is the developing age of that child. The developing age might not be the same actual age of the baby. This is a way to diagnose delayed babies. Babies who have a problem of development delay because of genetic problems. One of the things you ask about genetics. So certain genetic problem or chromosomal problems or certain syndromes will cause delayed development. And the way to detect that is either the pediatrician or the pediatrician can sometimes refer the infant or the child to some centers that have this chart, and they have the skills to estimate the developing age of the baby. Ideally, the developing age should not be a lot different from the baby actual age. But let's say a baby is or an infant is 1 year old, but the things that he's doing, he's not walking yet, he's not doing what's expected from 1 year. He's only doing what's expected from a 6 month. So that in that case, that child will be delayed in his development 6 months.
Yeah.
So there is graphs actually to tell you if what's expected at what age of that child, and then from these graphs you can estimate the developing age, and you can estimate what is the degree of delay of development of that child.
Dr. Hisham, we're ready for a break right now. We'll take a break and then come back with our discussion about human growth and development.
عيد سعيد يوم فرحان يوم جميل عيد سعيد عيد سعيد
Allahu Akbar, Allahu Akbar, Allahu Akbar, La ilaha illallah, Allahu Akbar, Allahu Akbar, walillahil hamd.
Now the moment our guests have been waiting for so long, the cupcake competition. You guys ready?
Yeah.
Muslims are singing praises to Allah. Allahu Akbar, Allahu Akbar, La ilaha illallah.
This idea that we need to be much softer with people around us, we need to be more courteous and accepting. This is one of the main sunnahs of the Prophet sallallahu alaihi wasallam.
This heart is empty right now, right? You start Ramadan with an empty heart. Okay, so we're going to put the empty heart in the big bowl, which is the body.
Everything I have, everything I own, everything I eat is thanks to you. Every breath I take, every bird I hear, every smile I see is thanks to you.
Don't despair and never lose hope, 'cause Allah is always by your side.
سعيد يوم فرحان يوم جميل عيد سعيد عيد سعيد يوم جميل يوم فرحان عيد سعيد. All over the world under the big blue sky, Muslims unite to worship Allah.
Assalamu alaikum and welcome back to the program. We've been talking with Dr. Hisham Tawakkol about human growth and development. Doctor, thank you for helping us understand these landmarks. I also want to talk a little bit about you and your organization. You said that this organization, can you talk about it, ABCDE?
Sure. So I'm actually the president of a non-for-profit organization which was established in the United States. As you know, there are more than 4,000 Egyptian doctors, board-certified doctors in the United States. So in January 2011, after the revolution, this American board-certified doctors, they wanted to do something for their country, for their homeland. As you know, all of us actually away from Egypt, and there is no chance for us to help Egypt as we want. So we decided to gather all of us to form an organization which already formed in the state of Washington, D.C., non-for-profit organization called the American Board Certified Doctors for Egypt. All the American Board Certified Doctors in the States, we gathered together to form this organization with our vision actually is to provide or augment the health system in Egypt to try to improve the health care in Egypt. And this is, from our perspective, is the least thing that we can do to our country.
And what kinds of, do you collect fees from your patients?
Actually, no, as I said, this is a non-for-profit organization. And luckily, recently, we did a lot of trials to incorporate our organization in the health system of Egypt. Luckily, lately, we have now signed an agreement with the Ministry of Health to send some of our physicians to come here to work in the Ministry of Health hospitals to try to help and provide our expertise to these hospitals that belongs to the Ministry of Health here in Egypt, in Cairo.
Okay, doctor, we do appreciate the service and appreciate you being here with us. Dr. Hisham is providing free medical services to his fellow countrymen here in Egypt. We have a telephone call, and also, this is a good example the doctor is showing us of the different ways that we can provide charity. This is one of the things that we should be doing as Muslims, and he's showing us an example of that, he and his colleagues. We have a telephone call now on the subject of asthma. Is the telephone call ready? Okay. The brother joining us is Dr. Hussein Ghaffar. He is a chest consultant. He's going to be talking with us about the asthma exacerbation. Salaam alaikum to you, doctor.
Hello.
Yes, welcome to the program, doctor.
Thank you. Thank you very much.
Happy Ramadan to you.
Happy Ramadan to you too and all Muslims all over the world.
All right. Well, we do appreciate you calling to help us understand some of the things that we want to try and avoid any, Ramadan is a time for families coming together, a lot of festivities. We don't want to spoil it by any exacerbation of existing asthma. Can you talk about things we can do during Ramadan to alleviate making asthma worse?
Okay, if we were talking about asthma as an asthma, this is a reversible obstructive disease. The patient usually complains of coughs, sometimes shortness of breath, and wheezes, or sometimes he gets the three together. When we have a terminology of the acute asthma or the exacerbation, sometimes we can call it a flare-up, sometimes we call it an attack or an episode. Mostly the patient has a progressive increase in the shortness of breath, along with some cough, and sometimes there's the wheezes and chest tightness. Also progressive decrease in the lung functions. And this means that we have a change in the patient's usual status, which sometimes requires or necessitates a change in the treatment. A patient could be already diagnosed as asthma, or sometimes this is the first presentation that he gets.
Is there such a thing as acute asthma?
Yes.
So I imagine this means that they don't chronically suffer, but maybe they can do something. Can you talk about the things that could cause a temporary asthma?
Yes, sometimes this is exacerbated by inflammatory factors or triggers, as we mentioned them. Sometimes it's a sort of allergen. And the allergen, this is the most common things are like the dust house mites and the cats, the dogs. Sometimes it's related to the work environment of the patient himself. If something dealing with fumes, mostly it occurs with the temperature changes. Sometimes we have an exercise-induced asthma when the patient stops running. Other factors may be related to the food additives, like the spices that they have on it, and of course, the air pollution, the second-hand smoking, the tobacco.
Yes.
And sometimes it's aggravated from something inside the body, like patients with gastric reflux or patient with nasal allergy.
Interesting. Okay, so we've identified some of the causes. Can you talk about some of the ways that asthma is treated?
Excuse me, I didn't catch this question again.
I'm
please.
asking about treatment.
Our treatment, okay. First of all, we have to identify our patients, and you have some patients with previous histories of near fatal asthma. This patient has been to the ER several times before. He might have been admitted to the intensive care unit. He even might have been on mechanical ventilation. He's not using his current medication that well. Very poor adherence. He's not using the inhaled corticosteroids, which is the main corner treatment of asthma. Some other patients are not on the treatment, and they are overusing a method of treatment which is the short-acting beta agonists, which is a bronchodilator, and he doesn't have a plan to be working on with it for his treatment. If we are gonna go on the patient in a stepwise, you first have to identify his complaint, and accordingly, gradually, we can start something like the anti-leukotriene. This is a tablet that is taken once at night. The patient is symptom-free with it. We can go on it for a while, and beside it, he can use the short-acting beta-2 agonists as needed. But if we started using it more like frequently every day, once or twice, this means that the patient needs to be maintained on regular treatment, which is in the form of ICS, or it's inhaled corticosteroids. It's taken twice daily. We add on it a long-acting beta-2 agonist. It's a bronchodilator, keeps the airways patent with the anti-inflammatory treatment that we are taking.
Okay, doctor, what advice do you have? Any special advice for asthma sufferers during Ramadan? Can they fast? Does fasting impact the asthma?
The most important thing that the patient needs to keep himself well hydrated. Well hydration keeps us away from possible attacks. The second thing, he needs to be adherent to his treatments. That means he doesn't miss any dose. The problem that we might face that the day is very long. The timing of fasting, and the action of our medication is 12 hours duration. So if the patient is well controlled, I advise him to fast, and usually we take the medication with the Maghrib and Al-Fajr.
Okay.
Maybe it's a little bit short duration, less than 12 hours, but as long as he's adherent, mostly he will pass on well. But in other very severe cases, and when the patient is kind of poor adherent to the treatment, I don't advise to fast.
Okay. Dr. Hussein, thank you so much for calling in and joining our discussion. We again wish you happy Ramadan and much success. May Allah accept your efforts. Thank you so much. That was Dr. Hussein. We'll go back to Dr. Hisham. So we've been talking with you about human growth and development. You were also giving us information about your organization.
Sure.
We've got about a minute left before we close out this program, this episode. What kinds of lasting advice, your final words?
For growth and development, you mean?
Yes, and maybe a particular question, if you could, some general advice about children fasting in Ramadan.
Sure. For the growth and development, this is the area that pediatrician actually will pick. So the advice here that for the mother is to keep the follow-up appointments for her baby or for her infant. The recommendation is to go for follow-up every certain month, every few months, to see the pediatrician, so he can look at the weight and the head circumference and the height of the baby to plot them on his curve. Also to assess the baby developmentally and see if that baby is developing as expected or not. So the advice here, of course, will be to keep the follow-up appointment with the pediatrician as it's scheduled.
Okay.
For the fasting in Ramadan, as we know, usually it is actually a training process. You know, we cannot really expect that young child will be fast all Ramadan from the first time. And as it happened to me when I was growing up and others, that usually they train us. So sometimes they start by fasting maybe like half a day, and then when we grow up more, then we make the half a day, you know, a little bit, a few hours more, until we can make actually few days fasting in Ramadan until the Maghrib time. So fasting for children is not actually, it's not prohibited. They can fast as long as they can afford the fasting. And as I said, it's a training process. Usually start by shorter hour, few days, and then you increase the hours and the days as the child is growing.
Okay. All right. Well, thank you so much, Dr. Hisham, for joining us. You've been with us for a number of times, and so thank you so much for opening up all these subjects. And we do wish you success, and thank you again for offering this free medical service to your fellow countrymen.
Thank you very much, and I'm really glad to be here with you tonight. Thank you.
All right, dear viewers, thank you also for tuning into the program. We hope that you found something beneficial and informative, and inshallah, we can have a very successful Ramadan. I think we're approaching the end of the month. We're waiting for the final days and hours before we reach the end. May Allah accept all of our efforts. We've been talking today with Dr. Hisham Tawakkol. He's a clinical pediatrician as well as a neonatologist, also the president of a non-government organization providing free medical services. It's called ABCDE, the American Board of Certified Doctors of Egypt. Thank you very much, and happy Ramadan to you, and happy Eid as well. Assalamu alaikum wa rahmatullahi wa barakatuh.